Did you know that 1 in every 10 children face actual migraines, and parents often mistake them for just another usual headache that is probably caused with screen time or excessive heat or something like that? So, today we are sitting with Dr. Abhishek, who will help us separate myths and facts on the information that's out there on migraine. We will talk about what triggers migraine, how to treat them, what are the early signs of identifying them in your kids, and all of those. So, doctor, let's start with a very basic question. Do you think migraine is an adult problem, or children also can usually face that?
No, it's a common myth which I often hear in the clinic that migraine is often seen in adults, but kids can also have headaches. Almost 1 in 10 school going children can have headache at one point of in their life. Often it goes unrecognized. Children are able to say directly that they have headache. Often the activity gets reduced. They stop playing. They would just want to sleep, or they would avoid lights, sound. So migraine, yes, is very common in kids also.
So, how do you think, from a parent's perspective, we can identify an actual migraine and our regular headaches?
Not every headache is a migraine. That's very important thing to understand. Sometimes other headaches can just improve with rest, good hydration, or a good night's sleep. But a migraine is just more than a pain. Children with migraine often have headache associated with nausea, vomiting. They would like to lie down in a dark room. They would avoid lights and sound. It's just not a headache. It's the first thing parents notice is change in the behavior.
So often it happens that parents think that migraine is an adult problem and kids usually can't have it. So when do you think that what age would the kids actually start seeing migraine? When does it actually trigger?
Migraine surprisingly can start as early as 5 to 6 years old in children, and it is not a problem which is seen often in adults, but yes, it can start as early as early childhood as well. Often during the adolescence the headaches can become more severe because of the academic pressure, stress, a lot of hormonal changes, irregular sleep cycle. So yes, migraine can begin as early as in the childhood.
And doctor, if a parent is supposed to be identifying these triggers, in a child, what would be the sum of things that they have to look for them? What would be the signs that they could see in the children and then identify, oh, this is migraine?
Often the child's activity starts becoming, the child becomes dull. He would not prefer to go and play outside. He would just want to lie down simply in a room. He would try to avoid lights, sound. Those are the things which help us to differentiate that yes, this is not just another headache, it could be migraine.
So, doctor, what are the things that actually cause migraine in children? What triggers it in them?
Every child is different, but there are quite common triggers which can cause headache. Common triggers in children include skipping meals, not taking enough water, often having irregular sleep pattern, lot of screen exposure, a lot of academic pressure. So, and certain foods can also trigger headache in kids. So, it's always better to maintain a diary, a headache diary, so that you can identify what is the trigger for your child and also analyze the headache pattern. So that helps us to know, okay, these are the certain triggers and that we can avoid them.
I'm going to pull that point where you said excessive screen time. How much of screen time would actually, bring in as a significant change in a child as migraine? Because how much role does a screen time actually play? Because most of the time, when children are identified with having headaches or migraines, the first thing that the parent goes is snatch away the tablet or the Apple Pad. So, how much do you think that plays a role?
Screen directly does not cause, but lot of screen exposure can cause other issues in the form of irregular sleep pattern, increase the stress, and that can probably trigger the headache, migraine headaches.
Parents often blame mobile phones and tablets for, children having headaches and migraines. How much do you think that screen time is actually responsible in migraines?
Screen directly does not cause headaches, but excessive screen exposure in a children who's already prone to them can cause headaches. So a lot of screen exposure causes eye strain that would disturb the sleep and indirectly cause migraine. So rather than banning the screen, it's always better to have a healthy habits like taking breaks in between, avoiding screen before the bedtime, and with some screen activity, always better to include healthy outdoor activities as well.
When children often have these headaches or migraines, parents usually try to, self treat them or give them home remedies at home. When do you think it starts becoming more serious, and when is the actual time for them to actually come out and see a real doctor?
Any child who has recurrent headaches because of which his activities like school is getting affected, he often stays home having a lot of absenteeism, is affecting his activities like he's unable to play, is affecting his sleep. So these are the times you should not ignore. Other signs which you need to know, or red flag signs, is any headache in a child which is associated with severe vomiting. The headache wakes up the child from sleep, causing sleep disturbances, causing visual issues, or the child having walking difficulties. These are the signs you should not ignore, and you need to seek urgent medical attention.
Right. So in these cases, we can't actually start doing home treatments or something like that.
Yes.
How do we usually diagnose childhood migraine? Do we need an MRI? Is that required because MRI is considered a little serious in adults as well, right? So do we need it?
Yeah, that's one of the most common concerns parents often, have. We always don't need to have an MRI to diagnose a migraine. Migraine is a clinical diagnosis. You always have to assess first the history. What is the child having? Is the child also having sleep disturbances? The child having associated nausea, vomiting? Is the child avoiding lights or sound? Is there a decrease in activity during the headaches? So clinical history along with the neurological examination, that helps us to diagnose, yes, this could be a migraine or some other headache. MRI is recommended if there are any warning signs, like child wakes up with a headache, with a severe headache, or upon awakening he has headache with vomiting, or is there any visual disturbances, or is there any walking difficulties. In those scenarios we order an MRI.
How are migraines usually treated, and when is it sign for us to actually start taking serious medication for it?
Every child with migraine does not need medicine straight away. Often, children can be managed by improving the lifestyles, like having adequate hydration, not skipping meals, enough sleep, involving some physical activity in the daily life, avoiding stress. So, most of the children can be managed without medicine by just adopting a healthy lifestyle. Some children, where the headaches are happening more frequent, their medicines might be required, that too on a short term basis. In every child has an individualized plan we treated.
So, can we say that migraines are curable?
Migraines can be treated if you are able to maintain a healthy lifestyle. Most of the children can maintain a healthy life, not having very frequent headaches. But once in a while, if there are triggers, we can manage them. So it's not that every child would require a lifelong medicine.
Can migraines usually affect children's studies or academics or their overall growth in general?
Absolutely. Frequent headaches will affect the child's overall activities. The child would miss school very frequently, might try to avoid sports, might feel, having low self-esteem, might be scared like when the next headache would come. So definitely frequent migraines will affect the child's, quality of life.
But sometimes, do you think that children might be able to use this as a bahana, to skip school or something like that?
Sometimes it is possible, but we will be able to identify the pattern of headaches, which help us to know that yes, is the child having really headaches, or he's just, trying to make those bahanas.
So guys, you actually cannot have bahanas in that case, because your doctor knows if you actually want to go to the school or you're just faking a headache. Can children or adults actually outgrow this migraine problem?
That's a very good question. Some children do, while others might continue to have headaches even into the adolescence or adulthood. It is very difficult to predict which child might, outgrow or not. But if you are able to identify migraines early and start adequate treatment, maintain a healthy lifestyle, children might be able to identify what are the triggers and then try to avoid, and thus reduce the frequency of headaches, and will be able to lead a happy life.
What's one mistake that you keep seeing that parents keep making with children that suffer from migraine?
Often parents think that the headache would just, go away in a day or two, and they often try to ignore. They don't try to, seek a medical attention. So the most important thing is, don't ignore regular headaches. If your child is having frequent headaches, often affecting his studies, his sports activity, it is better to seek medical attention rather than just avoiding and using sometimes just, over the counter painkillers.
Finally, doctor, what is that one message that you would want our audience to take away from this video?
If your child has frequent headaches, listen to them. It's a way of telling there's something not right. Don't ignore a child having frequent headaches. An early diagnosis, identifying the cause, and appropriate, management would help to improve their quality of life. And the most important, don't miss red flag signs. Any child who has recurrent headaches, wakes up with a headache from a sleep, has vomiting with headache or visual disturbances, is having walking abnormalities, don't ignore these signs. These signs require urgent medical attention. I hope you enjoyed this conversation. Thank you for watching this conversation. I hope it has helped you to understand migraines in children.
And make sure, guys, that you are looking out for your red flags, not just in normal relationships, but also in your children.